morning, everyone. There are 2 to 3 definitions of daycare surgery. Daycare anesthesia or daycare surgery or ambulatory surgery are all the same. Some may refer it as come and go surgery. It is the ambulatory surgery or daycare surgery refers to the practice of admitting on the same day of surgery carefully selected and prepared patients for a planned non-emergency surgical procedure and their discharge within 24 hours of that surgery. If suppose patient gets admitted in the afternoon, means 20, he may have to stay at the night. So after 24, within 24 hours of surgery, there are some definitions like coming on the performing surgery and discharge on the same day. Daycare surgery or anesthesia covers a wide spectrum of surgical procedures, which include specialities from all surgical branches, including operations under local anesthesia as well as operations under general anesthesia that can be major also. The advantages Sujit has mentioned, all of us know that it results in early mobilization, reduced hospital stay, reduced burden on the hospitals, and reduced cost. And a patient can go to his familiar environment. Also allows rest of the family members to get back to the routine quickly. There are many advantages of daycare surgery. But what is the scenario in India? We will see now. Daycare anesthesia is a novel concept, no doubt, but has difficulties and has some limitations in Indian scenario. So India is bearing 20% of the, what is the situation, is 20% of the world disease burden, but has only 6% of world's hospital bed. See the discrepancy. So how it is going to provide special beds or special burden, how it is going to bear special burden of daycare procedures. There is an immense opportunity for the expansion of daycare surgery because of increase in huge population and increase in private sectors, but it is still in infancy in India. For this to happen, there is an immense need of change in the mindset of concerned surgeon, anesthesiologist, and even patients also. So is it really possible to perform in India? When you assess from various aspects like patient select, surgical factors, infrastructures, and social factors, so we will come to know that it is very difficult in India. So how is the patient selection? Preoperative assessment and clinical acumen is very, very important in deciding the fitness of surgery. So what happens here? Anesthesiologists, we are many times busy. So considering daycare surgery is a minor surgery, and so anesthesia required is not a major one. So we try to assess many times we tend to assess the patient on the same day of surgery. So many medical aspects and many points in the history can be missed, so leading to some adverse outcomes. So patient should visit at least once 2 to 3 days prior to the anesthesiologist and surgeon. It helps to reduce anxiety, and it is very desirable to see and counsel the patient and patient relatives meticulously for daycare anesthesia. It establishes rapport and wins confidence on the patient. Selection of the patient is very typical one, and very selected patients are included in daycare surgery. And the patients with BMI more than 30 kg per meter square, age less than 1 year and more than 70 years can pose more difficulties in the intraoperative period. So poor selection may lead, and hurriedly seeing the patients may lead to the readmission. Adverse events are likely to occur. So we have to see meticulously the patient at least 2 to 3 days prior to the surgery, even if the surgery is minor and anesthesia. But even the surgery is minor, but anesthesia is never minor. Consider it is a major one. What are the other patient factors in India? Patients should also understood propose surgical anesthesia procedure wisely. Are the patients in India are smart enough? Majority of the patients are residing in rural area. So will they able to understand the NBM guidelines and medications taking on the same day of surgery? So we have to communicate clearly in case of problems arising in the post-operative period to the patient also? Are they smart enough to understand all these things? And our people, our nursing staff also should clearly get involved to communicate everything, that you can take clearly liquid 2 hours prior to the surgery. You should continue. Order should be given strictly that antihypertensives, all these things should be continued on the day of surgery. And patients and his relatives should also be psychologically not prepared to get discharged on the same day of surgery. They feel comfortable in the hospital environment. And as there are many problems, they had apprehension over poor access to healthcare if something goes wrong, if something goes in the post-operative period. Patients also psychologically feel comfortable in the hospital's environment. And nobody is, if we discharge on the same day, nobody is giving us any medal or award that you have discharged the patient on the same day. We, as well as anesthesiologist, surgeon, as well as patient, should feel relaxed. We should not play with the life of the patient by discharging the patient on the same day. So there is no hurry if patient remains for 24 hours. So what this study shows, the preoperative anxiety in adult patients undergoing daycare surgery is immense. So the factors significantly associated with perioperative anxiety were fear of injections, needles, fear of waking up during the surgery. So what this study mentions, a pre-anesthetic workup of a patient with adequate clarification about their doubts related to surgery and anesthesia is recommended to bring down the level of anxiety. If we, all of you, we know that if anxiety is more, the intraoperative demand of all the anesthetics, analgesics is increased, thus leading to delayed recovery from anesthesia. We have till now seen patient factors. When we see the surgical factors, whether daycare anesthesia is possible in Indian scenario, surgical fitness is very, very demanding. There should not be any risk of airway compromise or risk of hemorrhage in the post-operative period. Patients vulnerable for post-operative nausea vomiting should not be considered for these surgeries. And there should not be unnecessary traction and manipulation during the surgical procedure. And surgery should not last for more than 90 minutes. It is the prerequisite for daycare procedure. Otherwise, patient will have to stay for to more than 24 hours. So how it is possible? The skills, commitment, and expertise of the operating surgeon and anesthesiologist are of paramount importance in achieving successful and safe daycare surgery. So expert surgeons many of the times are attached to many institutes. From coming from one institute, going from one institute to another institute may take time because of so many factors. There is more traffic. To reach from one hospital may take more time. So starting of the surgery may likely to get delayed. And what happens in teaching institute? More residents are doing the surgery. It is their learning curve. How we can prevent them for asking repeatedly that complete it within shorter period of time? No, they will take their time. When the time increases, the chances of recovery from the anesthesia required will be prolonged and recovery will also be delayed. It is very impractical to call it as a daycare surgery in teaching hospitals. And surgeon should also be very, very expert in doing all these surgeries. And abdomen and thoracic cavity should always to be opened by a laparoscopic. Is it means possible for every surgeon to do by a laparoscopic? Means every surgeon is not that much of expert to do the surgeries in this way. This is all about surgical factors. What are the social factors? Patient place of residence to be within easy access of surgical facilities, which is not feasible in every patients in India. In rural areas, transportation is not easy. Urban places, due to traffic, difficult to reach to the concerned hospitals. Many times there is non-availability of money for appropriate transport facility. So patients are lately getting admitted to the hospital. Non-availability, the main concern is there is no concept of family physicians at many places. If something goes wrong in the post-operative after getting discharged, so whom to contact is a major concern. So how can the patient approach to the higher surgeon that has operated the patient in that hospital? So if the family physician is there, then he can very well contact to that concerned surgeon in bigger hospitals. So this is the many times is the worry in patient factor, social factors. So whom to contact? So better they will feel that we will stay for 24 or 48 hours in the hospital only. So we can remain safe. Other social factors, particularly elderly patients, tend to be restricted to bed due to generalized malaise and comorbid conditions and poor tolerance to pain. We cannot dare to discharge elderly people on the same day of surgery. They have low level of feelings of security amongst them at the discharge. We should weigh risk and benefit ratio on the same day of the discharge to that of next day. That I have already told that nobody is going to give us a medal that you have discharged on the same day. So we should take, and patient should take our own time, comfort to discharge on the same day. So we should not compromise safety of the patient by discharging on the same day. There is one study, factors hindering. What are the factors that are hindering in the daycare surgery in a tertiary care centers in southern India? This study was conducted among 89 patients who were fit for discharge on the post-operative day one. So there, most of the patients, 32 patients, were not willing were not satisfied for the decisions of for discharge on the post-operative day one. The common reasons for dissatisfactions with the decision were persistent pain at the operation site and non-availability of healthcare resources in their locality. I do agree with this study. Major concern for not performing day care surgeries everywhere in India is infrastructure. For daycare surgery, the prerequisite is there should be separate operation theater, there should be expert nursing staff, there should be dedicated OT, recovery room. So every hospital should possess this facility. There should also be a system for streamlined admission on the day of surgery without any time lag. The readmission procedure should be seamless as there can be urgent readmission. Do you think is it possible? Is there in every hospital this facility? There are not adequate operation theaters for routine operating list. How can we provide such dedicated OT only for daycare surgeries? There is a concept that the OT list is also should be a different one, daycare list and routine or the inpatient list. So residents, what I see in residents or everybody, they are providing OT list very lately, and no question of providing separate OT list of daycare surgery and that inpatient list. So in infrastructure in India, what is the scenario? Patients have to move around a lot to reach the proper concerned hospital. Theaters are not sufficient for routine cases. How can separate theaters are provided for daycare surgeries? There is deficient nursing. We are daily observing the status of paramedical staff, how they are trained. We have to repeatedly hammer to these people that they are not at all efficient nowadays. What is the scenario? They are not at all trained to handle all these situations. Then operation theaters at many rural areas are not well equipped. So no adequate medications are there at many places. Needless to say, paperwork most of the times get delayed. Patient comes for admission in institute because of paperwork, because of clerical mistakes or non-communication. Paperwork get delayed. Thus, discharge, admission as well as thus discharge is getting delayed. So it cannot be included in daycare surgery. So what this study says is consensus statement of anesthesia for daycare surgeries. So study was conducted amongst 9 senior anesthesiologists belonging to private and government setup. What they mentioned that overall 77% reported that there is no dedicated setup for daycare surgeries in their hospital, and 94% of the anesthesiologists, they were expert anesthesiologists, they're included from different private as well as government setups, and amongst 94% said that there were no dedicated anesthesiologists for daycare surgery. What do you mean by dedicated anesthesia? Means anesthesiologists also needs to be very perfect use of handling of recent drugs and adopting many methodologies for multimodal analgesia. So anesthesiologists also need to be expert in all these aspects. What are the type of anesthesia? Daycare patients require all type of anesthesias, local, TIVA, monitored anesthesia care, as well as regional anesthesia and general anesthesia. Judicious and titrated drug usage within that selected anesthesia is very, very important. Combination of more than one technique is required. That is use of NSAIDs, managing post-operative analgesia, multimodal analgesia is required, use of NSAIDs and nerve local infiltration, nerve blocks. Use of opioids may delay the discharge of the patient. Excessive use of opioids. So short-acting drugs like fentanyl, remifentanil, rocuronium, cisatracurium, are they available everywhere? Now we are getting fentanyl, but to procure fentanyl in individual setup, it is very difficult. And remifentanil, rocuronium are not available in ample Remicfentanil is not at all available, but rocuronium and cisatracuronium is not available easily. So that these are all short-acting drugs, and their elimination is rapid. Sevoflurane, desflurane, are they cost effective? Even though we are using sevoflurane, but everywhere is it available? Desflurane obviously not using nowadays, and sevoflurane is also not cost effective. Spinal anesthesia, if we give smaller gauge pencil point needles are available, but these are also not they are these are costly pencil point needles to prevent PDPH and urinary retention. It is the complication of spinal anesthesia. Mainly is a PDPH. So if you discharge the patient on the same day, do you come to know that PDPH is occurring, some problem is occurring into the patient? No, we are using still cutting needles. Many of the anesthesiologists are used to using 23 gauge of needle. They are not at all used to 25 gauge because of some fear of failure. Are the modern gadgets, modern syringe pumps and all these available to administer TIVA? No. Anesthesiologists also should possess skills of modern techniques handling newer gadgets like ultrasonography. Everybody is not trained to use ultrasound in the practice, and so that the delivery of or the giving of peripheral nano blocks gets hampered. So what are the concerns at the discharge in daycare anesthesia? Is pain is a major concern. So multimodal anesthesia is required. Use of NSAIDs, COX-2 inhibitors, paracetamol are to be used along with local infiltration. So mild pain can be well tolerated by the patient. If the pain is moderate to severe, patient needs readmission. Then post-operative nausea vomiting is also very distressing. Better to keep the patient in the hospital. So we have to use multiple drugs to prevent post-operative nausea vomiting. Nowadays, granisetron, pylenocetrons are being used, but personally, I have not used all these drugs. Hypotension, bradycardia that can occur after spinal anesthesia. This is a major concern. Bleeding also can occur if hurriedly surgery is finished within a shorter period of time. If you see removal of adenoids, tonsillectomy, so bleeding is likely to occur in the post-operative period. And PDPH, urinary retention, is also concerned after spinal anesthesia that I have already mentioned. Taking into the account points in all these factors, so how can one dare to discharge on the same day? In this study, anesthesia for daycare surgery, what are the current perspectives? There are n number of disadvantages mentioned by Sukhminder Singh Bajwa. That is, there is no doubt higher anxiety levels is there among the patients posted for daycare surgery. There is a always possibility of negligence in the preoperative anesthetic assessment leading to medico-legal issues. There is lesser compliance to preoperative fasting instructions and preoperative medications in rural scenario and in India as a whole, and surgical and anesthetic complications resulting in unplanned readmissions to the hospital is more in daycare surgeries. We have to acknowledge the progress we made, but understand that we still have a long way to go. That things are better, but still not good enough.